Hello, everyone. Thank you very much for listening to me. Sorry, I've been away from YouTube for about 3 years, but had a lot of requests from a lot of doctors who have reached out to me over emails and have been in touch. So I'm very indebted and humbled that I've been requested to come back into making YouTube videos again. So now I'm going to try and regularly post on YouTube, probably once a fortnight, and keep you abreast of the situation. Basically, I stopped recording videos about 3 years ago because when I got a job as a chief medical officer for an international cricket team, and essentially the job was very busy, and also there were some media restrictions on what things I could and could not do. But now I'm back in Australia and doing my GP training. So today's video is going to be more focused on GP training and what sort of programs are out there. The main one, the program that I'm doing is the AGPT, which is the flagship program in Australia that a lot of doctors do. For to be in this program, you either have to be an Australian citizen or a permanent resident. So, and this program is very structured. It's a 2-year program with if you have already done 1 year of hospital work. And essentially, all you need to do is just be a part of this program, and it's quite a smooth running in terms of the program. The program is very flexible, so you can do it part-time or full-time. If you do it full-time, that's obviously 2 years. Part-time will take longer. You can sit your exams after the first year, and then essentially once you've completed the time, then you become a fellow GP. The program will ask you to work in at least 2 different practices for a variety of practice purposes and understanding the different dynamics of the practice. It's very structured because you get teaching time, individual teaching time, one-on-one, at least 1 to 2 hours every week with a supervisor. And the program is free as well. So you don't have to pay anything for the program. The government completely subsidizes it. In fact, if you're doing it in the rural side of things, which I am, then you can get anywhere between 5 to 25,000, depending on where you are, as an additional incentive of working in the GP program. Now, as I said, in Australia, there are different GP stream programs. The 2 most common ones are the AGPT, which I already spoke to you about, and the other one is the FSP. The main difference between the two is really AGPT is very structured. So there's a list of clinics and you'll be matched into one of those clinics. So you have little autonomy in which clinic you can get into. Whereas in the FSP program, you can actually decide which clinic you want to go in. So you go and search your clinic as long as it's an MM2, modified Monash criteria 2, which basically is the rurality of the location. And I can make a different video on that. But essentially, if you go to Dr. Connect, you search up Dr. Connect and modify Monash, and it tells you which locations you can work and train in as a GP. Both programs are run by RACGP. So that's the update from my end. Please feel free to put in comments, and I'm happy to make more videos and tell you a bit more about the programs. Of course, the one thing that everybody wants to know about is how much do GPs earn. So as a GP registrar, you unfortunately start off at the lower end of the scale. So you make around 45% of the billings the first 6 months, and it goes up by a couple of percent every 6 months. But generally, that's what the case is. And typically, normally a GP would make somewhere between $2,000 and $3,000 a day. So if you're making about 45% of the billing, then you're somewhere around $800 to $900 a day, depending on how many days you're working. You can calculate it from there. Obviously, everything is taxed, so you pay another 30% on top of your billing. So typically, the take home for a new registrar would be somewhere between $500 to $700, depending on how many patients you have seen and how much you've worked. There's also a baseline salary, which is about $55. So if you are seeing fewer patients or some days patients have not turned up, it will get a base rate of $55 an hour. But that was a quick update from my end, and I'll post more videos as we come along.